Hello, everybody. So, welcome to One Day, One Disease, One System series. आज का हमारा टॉपिक है द इंजन ऑफ लाइफ गैस्ट्रोएंटेरोलॉजी। जी हाँ, सीलियाक डिजीज, कॉन्स्टिपेशन, डायरिया, बहुत सारी गॉल स्टोन्स जिसमें लैप्रोस्कोपी करनी पड़ती है, बहुत सारी टेक्निक्स है, बहुत सारी डिजीजेज है, चाहे वो लीवर हो, चाहे वो स्मॉल इंटेस्टाइन, लार्ज इंटेस्टाइन, अल्सरेटिव कोलाइटिस, इन्फ्लेमेटरी बाउल डिजीज, इरिटेबल बाउल सिंड्रोम, hepatitis, cirrhosis, fibrosis, metabolic fatty liver, non-alcoholic fatty liver, lot of diseases which occur. So सबसे पहले तो आपका स्टार्ट होता है माउथ, टीथ, टंग, जहाँ पे you have salivary amylase, teeth which breaks down, chews, grinds, incisors, canine, premolar, molar. You have different taste receptors on the tongue, right? There's ingestion, followed by the digestion, in which there's mechanical digestion and chemical digestion. Then there's absorption and assimilation through the villi and microvilli. And finally, the excretion through the colon and rectum. So, this is a master process from the ingestion to egestion. So the mouth has the mechanical breakdown and the chemical breakdown using amylase and mechanical using the teeth. The esophagus is like a peristaltic tube, and there are lower esophageal sphincters which prevents the reflux, gastroesophageal reflux, because you usually have acidity, acid reflux, and GERD or Zollinger-Ellison like syndromes. Then the stomach, which secretes the HCl, an intrinsic factor which is important for the B12 absorption. The liver is one of the largest glands, and you have salivary gland, liver, and pancreas, the three types of glands in your gastrointestinal system. The gallbladder stores the bile. It is produced in the liver, stored in the gallbladder, and the pancreatic enzymes like pancreatic lipase, pancreatic amylase, trypsin, right? All of these enzymes. So the intestine is like a hub. You have duodenum, jejunum, ileum that are causing local contraction in the motility, which leads to absorption of carbohydrate, protein, vitamins, minerals that are directly transferred into the bloodstream. So, the waste management, here you have the large intestine, the colon, ascending colon, descending colon, sigmoid colon, transverse colon, the different types of colons which are responsible, right? So, the primary function is to absorb water and electrolytes to desiccate liquid chyme into the solid stools, liquid chyme into the solid stools. Then these are cecum. Cecum is the site through which there is feces which are formed or eliminated. Acha, in the comment box, tell me which are the pigments which give color to the feces. Many times there are a lot of diseases and you have to perform the endoscopy, colonoscopy, sigmoidoscopy like techniques uh, in case of severe, because there's mucous membrane which is damaged causing peptic ulcer like diseases, mostly because an imbalance in the aggressive and defensive factors. However, sucralfate, having sucralfate or PPIs or anacids can help you decrease this condition. Crohn's disease is when there's selective inflammation of this few parts of the intestine, and ulcerative colitis is when these are like inflammatory bowel disease. They are autoimmune. Irritable bowel syndrome is a functional nutritive disease. So these are treated by the biologics, immunosuppressants, and corticosteroids. The hepatics of fibrosis, cirrhosis, non-alcoholic fatty liver, metabolic associated fatty liver, hepatocellular carcinoma. These are different liver damages and conditions, finally leading to the cancers. And also there's a colorectal cancer. Mostly your sedentary lifestyle, the diet, the medications, the some interventions like the radiations and all, they are responsible for this. Imaging techniques, you can perform CT scan, MRI for the structural assessment, barium contrast studies for the structural abnormalities, direct visualization, colonoscopy like techniques, or you can use biochemical markers like the stool test, feces test, liver tests for the H. pylori, breath test. A lot of pharmacological interventions are given like antacids, H2 blockers for the GERD and ulcers. For the constipative like conditions, you give agents like isabgol, castor cathartics, purgative laxatives. For diarrhea, in which there is Shigella dysentery, Clostridium difficile, Vibrio cholerae, E. coli, diarrhea, and Entamoeba histolytica. A lot of different causes of diarrhea. So you can be treated by the anti-motility drug loperamide or diphenoxylate, right? Different probiotics like agents that will counter the motility action. Surgical, either there's cholecystectomy, in which you cholecystectomy is a process in which you remove the gallbladder, gallstone. bowel resection, in which you remove the disease segment, liver transplant for the end stage renal disease or end stage liver disease, gastrectomy, removal of stomach itself in case of severe cancer and ulcers condition. Future direction, developing the FMT, fetal microbiota transplant, because the good bacteria and bad bacteria, a combination of this is very important. That is the firmucoids and the bacteroids. That is why prebiotics, pro-prebiotics, para-probiotics, postbiotics are very commonly given for the management of this, right? So this is it for today's system. I hope that this is clear to all of you, because we have covered cardiovascular, nervous, lymphatic, endocrine, musculoskeletal, and gastroenterology system till now. Ahead, we will be covering the genitourinary reproductive system, sensory organ systems as well. So, if you haven't watched the 12 organ, 12 days series, kindly have a look. It is really amazing. You're going to learn about anatomy, physiology, pathophysiology, treatment, therapeutics, diagnosis like radiological markers, non radiological markers, microscopic markers. What are the different diseases? How do they occur? What are the different organs which are affected? How do you treat them? Everything. So, thank you so much for your patient listening and time.